Hello everyone, welcome to another episode of Newsflash on the show. We're going to be talking about the coronavirus. We're going to give you live updates about what's going on as infections continue to skyrocket. Also, critics say that the Trump's EPA's formal assertion to that glyphosate poses no risk to human health is an indication of a troubling allegiance with Bayer and Monsanto. With the quote, "It's open season on clean air, water, and soil." People, poor disabled people in particular, are going to die if Trump is reelected and able to take an axe to these very, very important entitlement programs that we talked about with Chase. We're also going to take a look at an ER doctor confronting Mike Pence in Iowa over said Trump Medicaid cuts. And also, John Hickenlooper, an establishment pick for the Senate seat in Colorado, has an increasingly stale record. Finally, Postal Workers Union endorsing Bernie just a few days before Iowa. We'll also give you a window into how we plan to cover Iowa a little bit at the end of the show, so you're going to want to stay around for that. It's Newsflash. Let's get started. All right. We start at the top today with the very scary coronavirus. It's now a level 4 warning, the highest tier, and it urges Americans to avoid travel to China. The State Department issuing an official warning. More than 200 people have died, with about 9,800 infections confirmed. Facebook says it'll stop a virus-related misinformation, so that's always good to hear with Facebook saying they're going to stop something. But, of course, you can never really trust Facebook on anything. The first two cases have been reported in Britain now. In a twist, China is going to be evacuating Wuhan residents from foreign countries to treat them at this point, and it really is pretty insane. So we'll start here with the State Department issuing a travel advisory telling Americans not to travel to China because of the public health threat posed by the dangerous new coronavirus. The department has set the new advisory at level 4 or red, its highest alert, reserved for the most perilous situations. Travelers should be prepared for travel restrictions to be put into effect with little or no advance notice. Commercial carriers have reduced or suspended routes to and from China, which is not fun for their economy there, or for anyone's economy. The World Health Organization on Thursday, or actually maybe the U.S.'s, because literally Wilbur Ross comes out and says, "Oh yeah, it's going to be great for the economy. It's going to help bring jobs back at an even faster pace, guys. You're going to love it. Like, the coronavirus is going to be lit for America's jobs. Woohoo!" But obviously we can't ignore the fact that people are suffering. There is a lot of people who have passed away about this, and the cases continue to rise. The World Health Organization on Thursday declared the outbreak a global emergency after cases were discovered in more than a dozen countries. More than 200 people have died with about 9,800 infections again confirmed. The number of confirmed coronavirus cases has gone up more than tenfold in a week. And Chinese officials on Friday reported the highest death toll in a 24-hour period. 43 deaths in China were announced, bringing the total to 213. Nearly 2,000 deaths were recorded in the country in the past 24 hours. New cases were recorded in the country, raising the worldwide total to 9,800, according to the Chinese and World Health Organization data. And they're all around the Wuhan province of China, and kind of a massive portion of the lower right-hand side of China. If you look at it straight on, for example, on a map, there are some surrounding countries, like the Philippines has a few cases, Taiwan has a few cases, Thailand has 14 cases. It's pretty tough. Tibet has reported its first confirmed case. That means all of China's provinces and territories have now been touched by the outbreak. France and the United States have 6, South Korea and Germany and the UAE have 4, Canada has 3 cases, Britain, Vietnam, and Italy have 2. And India, the Philippines, Nepal, Cambodia, and Sri Lanka and Finland each have one. Cases recorded in Taiwan, Germany, Vietnam, Japan, and France, and the United States have involved patients who had not been to China. Interesting. No deaths have been reported outside China, luckily, as it stands now. Let's get a little bit more about what Facebook's doing to get a handle on the misinformation coming out about this. Facebook says on Thursday that it is taking several steps to prevent the spread of misinformation related to coronavirus, including removing content with false claims or conspiracy theories that have been flagged by leading global health organizations and local health authorities that could cause harm to people who believe them. The statement provided examples. Quote, this includes claims related to false cures or prevention methods like drinking bleach cures and the coronavirus, or claims that create confusion about health resources that are available. The company, which plans to promote important virus-related updates at the top of its newsfeed, also said when its third-party fact-checkers rate information as false, the information spread will be limited on Facebook and Instagram, and users will be shown accurate information instead. Thank goodness for that, because again, I've seen some pretty crazy posts about this on social media, especially if you look on Instagram. People are like, oh my gosh, the corona, like people said, oh yeah, the coronavirus is at LaGuardia. Like, no, it's not it's obviously not at LaGuardia, but it's like, it's really the most ridiculous, it's probably one of the most ridiculous aspects of it. It's just kind of the crazed American reaction to this. On Wednesday, Twitter made changes to its search algorithm, prioritized results from reputable health organizations about this. It said that those changes were in place only in Australia, Brazil, Canada, Hong Kong, Japan, Malaysia, New Zealand, the Philippines, Singapore, South Korea, Taiwan, Thailand, and the U.S., and Britain, and Vietnam, but they would expand as needed. Twitter is blocked in mainland China, so that's not going to really matter too much for them. But the big thing is the first two cases now have been confirmed in Britain, right as they prepare to leave the European Union. On Friday, Britain's chief medical officer, Chris Whitty, said that the two residents had tested positive for coronavirus. The first known case is in the country, so it's pretty disturbing. In a statement, Whitty said the patients were members of the same family. The NHS is extremely well prepared and used to managing infections. We're already working rapidly to identify any contacts the patient had to prevent further spread. So anyway, the announcement came as a flight carrying 83 British and 27 foreign nationals from Wuhan, China, the center of the outbreak, were expected to arrive in Britain on Friday afternoon, so probably arriving pretty soon, a few hours British time. The Britons were to be quarantined at a center in Wirral in northwest England. The others will be flown on to Spain. That brings the 19 the total number of countries with confirmed cases of coronavirus. Britain's NHS said it's very well prepared and did an extremely good job of creating and caring for patients with Ebola, said the Sarah Gilbert, professor of vaccinology at the Jenner Institute at the University of Oxford, referring to the virus outbreak in 2014. Her team is developing a vaccine against the coronavirus and expects the first clinical testing in June, Professor Gilbert said in a phone interview on Friday. Hopefully that it's not so much of a problem by then. From there, it will need to be extended into further trials. What's done next will depend on how much the virus spreads around the world. As foreign governments evacuated their citizens from China this week, the government of China said it was arranging chartered flights to bring Wuhan residents who were overseas back to the epicenter of the outbreak, citing the practical difficulties recently encountered by residents abroad. The Ministry of Foreign Affairs said in a statement Friday that evacuations would begin as soon as possible. The decision to facilitate people's return came after Wuhan's mayor revealed 5 million people had left the city last week ahead of the Lunar New Year holiday. 5 million people leaving the city all at once. Again, before these travel restrictions were forced, trying to get out of there while they can. Unnerved by the exodus, some regional countries and territories have banned entry to people from Wuhan or Hubei province. travel restrictions across China and the suspension of international flights to the country have led Chinese travelers stranded around the world. All right, so that's a little bit of the coronavirus updates from the New York Times reporting there. Yeah, so the streets, the incredibly eerie, weird place to be for sure is China, and especially the Wuhan province, as this all picks up. All right, let's turn now back to more domestic politics. Trump's EPA is now making a formal assertion that glyphosate, I'm going to go with glyphosate as my pronunciation there, it poses no risk to human health indication, and that's apparently an indication of troubling allegiance with Bayer and Monsanto. Let's read a little bit more about that. President Donald Trump's EPA on Thursday wrapped up a regulatory review of the safety of the weed killer glyphosate, and found that chemicals poses no risk to human health, a decision that was immediately decried by advocates as another indication of the closeness between the administration and the private sector. And this really just seems to be the type of move the Trump administration makes that just is like unnecessarily like stupid and cruel and just kind of barbaric. But of course, like, you do know why. It's because they have deep ties. Like, they're people, like the people leading the EPA, they're deeply tied to the natural gas. They're deeply tied to everything to do with pharmaceutical companies. Like, these are all probably lobbyists who have easy access to the Trump EPA. They just get a permanent parking pass at this point. They're pretty much just allowed to walk right in. Yeah, so Trump's EPA's assertion that glyphosate poses no risk to human health disregards their independent science findings in favor of confidential industry research and industry profits, says Lori Ann Bird, the Center for Biological Diversity's Director of Environmental Health. This administration's troubling allegiance to Bayer, Monsanto, and the pesticide industry doesn't change the trove of peer-reviewed research by leading scientists finding troubling links between glyphosate and cancer. So that is going to be incredible, because the Monsanto thing in Roundup, like, they were sued over that. Like, this is something that has already caused immense harm legally for Roundup and Monsanto, the company who makes it. And yeah, they're still holding on to that. They're still trying to push those profits, and Roundup is still on the shelves. The EPA formally declared Thursday that the weed killer poses no threat to human health. But despite literally all evidence, the EPA came to the conclusion after reviewing the chemical's effect on humans, but the determination is unlikely to change views on either side of the conflict over the chemical safety. A lot of people will disagree with the EPA, tweeted Civil Eats founder and editor Naomi Starkman. As Reuters reported, the conclusion reaffirms the agency's stance on glyphosate, the key ingredient in Bayer's AG's Roundup, despite judgments by U.S. juries that have found that the weed killer was responsible for plaintiff's cancer in some trial. In 2015, the World Health Organization's cancer arm classified glyphosate as probably carcinogenic to some humans. There are reportedly tens of thousands of lawsuits against Bayer Monsanto for the chemical's cancer links, and the company is considering settling claims for between $10 to $12 billion. So, yeah, that's a pretty substantial amount there. It is one that's like, it kind of shows you that there may just be a little bit of a problem here. Like, there may just be a little bit of a problem with this chemical. So yeah, just please, if you're out there, public service announcement here for all those who may be listening: do not buy Roundup. Just don't do it. Just don't do it. Anyway, yeah. So we now turn to an interesting story that is very, very disturbing. Probably has a little bit more broad-reaching effects. It's because you really need good health insurance, even if you don't plan on buying Roundup, which again, you should not. Anyway.